Dr. Hummers, would you like to join in on this and maybe get into some of the prevalence of chronic fibrosing ILD with the progressive phenotype?
Yeah, I think it's really tricky to try to determine a progression, because this really is multiple different entities. I think each one of these individual entities is fairly uncommon. So, idiopathic pulmonary fibrosis, scleroderma-related ILD, myositis-related ILD are all individually fairly uncommon and have prevalences which are fairly low in the population. The prevalence of scleroderma is about 250 per million. And then, as was already mentioned, the prevalence of ILD amongst these groups is highly variable depending on how you define it. And some diseases have more common features of ILD amongst the population and others less common. And then the population of which is progressive can vary from disease to disease as well. So if you take rheumatoid arthritis, which is actually a fairly prevalent disease, it's about almost 1% of the population can have rheumatoid arthritis in the US. But the prevalence of interstitial lung disease amongst rheumatoid arthritis patients is actually a little bit less common than, say, in scleroderma or myositis or some of the myositis subsets. And the progressive phenotype amongst rheumatoid arthritis patients is fairly uncommon amongst that group. So it's really tricky to kind of put a prevalence number, I think, on the subsets of all those diseases which are in this kind of chronic progressive phenotype. But there are diseases where we do know that fairly well. Like, we know that most patients with idiopathic pulmonary fibrosis are going to have a progressive course, and there's a subset of patients with scleroderma and myositis, which tend to have a progressive course as well.
To the original point of the progressive fibrosing ILD or chronic fibrosing ILD with a progressive phenotype, as we heard, we just really don't know much about it at this point. Within individual ILDs, there are some data that suggest 25 up to 50% of patients will have a progressive phenotype depending on the ILD you're talking about, but we really don't know much about this phenotype in general. It is definitely a new idea in the field. As I said, we were trying to group patients according to these similar patterns previously, and now we're accepting that the pattern may not matter as much as the natural history. And so I think one takeaway from this is that this idea of chronic fibrosing interstitial lung disease with a progressive phenotype is a new idea, and there's a lot to be done to characterize it. As far as the background pathophysiology, without getting too deep into the rabbit hole of basic science, I think it's important to note that this progressive phenotype does manifest in fairly similar ways across the ILD spectrum, which is development of new scar or new fibrosis throughout the lungs. This is a TGF-beta mediated process generally, and we know the most about this through studies done in idiopathic pulmonary fibrosis, but there are an increasing number of studies in other ILDs that show a similar final phase that leads to this fibrosis and progression. I will say that some of the more inflammatory interstitial lung diseases like hypersensitivity pneumonitis and those due to autoimmune disease can have a preceding inflammatory component that we don't see in IPF, but they still result in a similar final pathway, which is fibrosis.
And is that progression similar across different types of patients?
Well, it depends on how you describe or define progression. For our purposes in interstitial lung disease, we typically look at decline in lung function, but it's appreciated that you can progress in different ways. You can have a drop in your vital capacity is probably the most well accepted way that you're having progression, but a small decline in your vital capacity with a large decline in your diffusion capacity and worsening symptoms, to me, suggests progression. Same thing if you see more fibrosis on the CT, maybe only a marginal decline in your lung function, and somebody's having worsening symptoms, that again suggests some degree of progression. And so there's just a lot of unknowns in the field, and to try to say at this point what progression looks like, I don't think is possible, but there are certainly a lot of ways progression can manifest.